Last time we talked about restrictive lung diseases. Now I want to take a look at another case. Let's say you had a second patient and you sat them down. They were experiencing some trouble breathing, specifically wheezing noises and uh, coughing and hacking and stuff like that. You get them through a spirometer and they have a graph that looks something like this. Obviously, there's a problem with the forced vital capacity, but what's more interesting to me at this point is the long time that it takes for them to get to that vital capacity, meaning that the forced expiratory volume in 1 second is extremely low. Now, this patient in particular is not able to breathe out very quickly at all. In fact, they are able to get to a vital capacity much later than a normal individual. Their flow is not right. And this would be the case of an obstructive lung disease. And these are not nearly as easy to see in a spirometer because there are some conditions that we have to calculate. First, we can assume that there is something wrong if the reduced or the FEV1 is reduced and is less than 80% of the predicted normal. This one here is like a fifth of the amount. It's like 25 or 20% of the amount. So this is clear as day. Something is wrong. But something that often happens with obstructive lung disease is that the lung itself is working fine. It has a normal vital capacity, and this forced vital capacity might be only a little bit reduced, to a lesser extent than the FEV1 was down low. In fact, we could have a FVC that matches a normal forced vital capacity of someone who does not have an obstructive lung capacity, because that person might be able to draw in enough air and breathe out enough air, but they wouldn't be able to do it as quickly because they have something obstructing their airways. The lungs are fine in this case. They might be just peachy keen, but the airways are causing a restriction in, or excuse me, an obstruction in flow that doesn't allow the air to get through as easily. And so in order to be able to really determine whether or not someone has an obstructive lung disease, besides just looking at the long amount of time that it takes for someone to get to their forced vital capacity, is we would use a ratio. This ratio is called the FEV1 over FVC ratio. And this number that we're looking for is going to be normal if it's about 0.7. If it's less than that, as this one looks like it would be here, it would be considered an obstructive lung disease. This FEV and the FVC ratio is not usable for a restrictive lung disease because if we look at a restrictive lung disease, it looks like the shape of the graph is just about the same as it should be if they had a bigger vital capacity. It's just a lessened vital capacity. But in this case, we can see that the lungs are not getting to the vital capacity quick enough. And so that ratio, the amount of time that it takes is going to be greatly increased, and the ratio is going to be much decreased. Anytime I have you calculate these values, I will give you the specific numbers. We can just look at the graph more often than not, but sometimes the person might just be experiencing one specific time in which they have a reduced FEV1 FVC ratio. So it might be something that you have to test multiple times in order to get the proper measurements. Now, there are plenty of obstructive lung diseases out there, but the most common ones are COPD or emphysema. We have the clogging of those airways with toxins that we put in from drugs and so forth. But another common one is just your everyday asthma. We have the constriction of the smooth muscle in the trachea and bronchi and bronchioles, causing the airway to be much reduced, which means that the air can't flow through as easily. In addition, asthma typically has a buildup of excess mucus inside of those tubes, which reduces those even further. Another common, I wouldn't say common, another hallmark obstructive lung disease would be cystic fibrosis. Cystic fibrosis is a condition in which the airways, the trachea, the bronchi, and the bronchioles, are producing more mucus, but it's not the same aspect of asthma. Asthma just does it because it's continuous. But the cystic fibrosis is going to happen more often because these fibers that are inside the trachea, the bronchi, and the bronchioles are degenerating over time. And to fill in the gaps, your body is producing mucus so that your body can prevent some infections from getting into your lungs. So it's almost like your body is trying to make more mucus because your airways are degenerating in some way. And the swelling occurs inside there as well, which causes restriction in these airways. So again, when we look at these obstructive lung diseases, we're looking for a very slow buildup to the forced vital capacity where the FEV1 is greatly, greatly reduced. And to make sure that it's greatly reduced, we're going to use a ratio, the FEV1 divided by the forced vital capacity, to be able to determine if it's less than 0.7. That's going to be the ticket.